Welcome back. Right now, we are going to focus on your finances, especially with open enrollment. A recent survey was done that showed that in a lifetime, the average individual spends over $700,000 of their own money on their own health care. So that's an alarming amount, much higher than people estimate or any of us even realized. Right now, we have financial expert Jean Chatzky here to tell us all about this. Jean, thanks for joining us. How are you?
I'm good. Thanks for having me.
So tell me more about this survey. It's definitely something that we all need to think about and consider.
Yeah, you are so right. Synchrony commissioned this study of 3,200 people and found that for people who have an employer health plan through their employer, they're looking at $320,000 in unreimbursed healthcare expenses over a lifetime. For people without that employer coverage, it's $700,000. And the big problem with this is that because people are unprepared for these costs, because we're not saving for these costs, when medical procedures hit, we are kicking the can down the road. We are delaying, and that just winds up with a medical situation down the road that is often much more complicated and much more expensive.
Those findings are very surprising to me, but for you as a financial expert, what really took you by surprise when you saw the results of this survey?
What took me most by surprise is that we save for the other big expenses in our lives. When we look at college, when we look at buying a home, when we look at retirement, we put money away for all of those things in separate accounts on a regular basis. We're not doing that for healthcare, and we should be. 4 out of 5 people told us they don't have a separate savings account for healthcare expenses. That definitely needs to change.
I think with many individuals having insurance, you tend to rely on that. And while that does cover a lot of the costs, there's definitely this gap here. Why is it so important to consider these out-of-pocket expenses?
Because they're going to happen every year. I mean, when we looked at the experiences, the expenses on a year-to-year basis, people are estimating $850. It's actually costing them closer to $2,100. And there are solutions available, solutions like health savings accounts and flexible spending accounts that will not just save you money, but actually save you money on taxes, which is very appealing to a lot of people. There are financing solutions, but people don't know they exist. And that's why it's really important to get educated. The folks at Synchrony put together an educational resource. You'll find it at carecredit.com/wellyou. And if you go there, you'll find information on the costs of various procedures, which is important because these things are not transparent. You'll find information on those financing solutions and how to set up a health savings account or a flexible spending account, and information about how to have these conversations with your own doctor and medical professionals about cost, which far too few people do. And if you want more information on the study itself, because there's a lot of valuable data there, you can go to carecredit.com/lifetime-study / and I hope we'll put that up on the screen. But both of those resources together are a really valuable tool in your healthcare arsenal.
These are all extremely valuable tools. Anything else that we need to know about this so that we can feel confident in our budgets and our savings, especially around healthcare?
I think the most important thing to understand is that these things are going to happen whether you prepare for them or not. And so you are just better off being prepared. Save a little money today so that you'll be in better shape tomorrow.
Always great advice. Thank you so much, Jean Chatzky, for joining us today. Really appreciate your time with us right here on Park City Television. We are going to take a break and get back with much more here this morning after this.